Coming up next, we have two labor and delivery expert witness nurses who will focus on a topic that is of great concern, and that is postpartum hemorrhage. It can be intrapartum, it can be prenatal, many spots in this pregnancy cycle, as we've talked about today, where bleeding can occur, and if not recognized and treated, can be devastating. Sasha Benner and Courtney Moorhouse are my guests in this podcast. What were some of the topics that we covered in your podcast?
Yeah, some of the topics that we are covering in this podcast is going to be at what point during pregnancy can bleeding occur? Fun fact, all of it, very beginning to very, very end, and even after baby is out. We talked about what our postpartum hemorrhage risk factors are and what those assessments look like, specifically in an in-hospital setting, and why those are super important to be done and done frequently so that everybody is on the same page, especially for those high-risk patients. We talked about if our patient is at a really high risk for postpartum hemorrhage, what are those things that we do to keep them as safe as we possibly can and help mitigate any issues. Hopefully, sometimes people bleed, and our goal is to be as prepared as we possibly can to help those mamas. And then we talked a lot about what delayed postpartum hemorrhage is. It's one of those things you don't really think about. You know that people bleed after they have a baby, but what's happening when they're bleeding a lot more at 5 weeks postpartum? Like it's a little bit out of most people's wheelhouses. So we did talk about, what to look for with just general postpartum bleeding and what specifically to look for with those delayed postpartum bleeding patients, because those are the ones that come back into clinic or into the emergency room, where they might not be face-to-face with an OBGYN, a midwife, or a labor and delivery nurse, where we do this all day, every day. One fun thing that we talked about was what this having Cursign or shoulder pain during labor can mean, because you're pregnant. Why are you having shoulder pain? So we touched on that. And then we talked about what some of the causes of bleeding after delivery are. So it's not just things like having, a tear in your perineum or just having a C-section. There's a lot of other things going on that make these patients really, really intense, acute patients that need all hands and eyes on them at all times. And that's it.